Welcome to The Backstory with Dr. Ricky Singh. This podcast is focused on bringing you the latest research-based information about dramatically improving health, well-being, and quality of life. And here's your host, Dr. Ricky Singh.
Today we're going to take a deep dive into one of the aspects of lifestyle medicine in diet. You know, lifestyle medicine consists of so many things, being physically active, stress management, sleep, so many preventative health strategies. But today I really want to talk about diet and also mindfulness and meditation, certainly if we get to that. You know, at one point we thought about lifestyle medicine kind of as preventative medicine, trying to prevent patients and the general public from needing Western allopathic or osteopathic care. But I think the more we're learning about it, we're realizing that modifications of lifestyle can also treat illness and transform illness into health. So my guest today has more than 20 years experience of meditation experience, performing research at the Emory University Mind-Body program. He is a plant-based physician emphasizing lifestyle change through diet and exercise. By training, he is a vascular and interventional radiologist at the Brooklyn Hospital Center. And while we're not, unfortunately, going to talk a lot about what he does professionally, we're going to focus a lot on his lifestyle outside of work. And I really want to learn about how he balances work, life, family, things like that. So I'm really excited to hear from our guest today. Dr. Sumeet Bahl, welcome to The Backstory.
Thank you. Good to be here.
Tell me about your upbringing. Where did you grow up initially? How did you end up in the career choice and specialty that you're currently practicing?
Yeah, so I grew up in Atlanta, Georgia, with my parents. Don't have any siblings, and my grandmother lives down there. And I've wanted to be a doctor, like a lot of people, since I was a little kid. I grew up, especially being in a Indian family, you kind of grow up around doctors all your life, and you look at them and you see this sort of respect, and you sort of see what they do, and you're inspired by it because these people are living this great life of being able to help a lot of people, but live a reasonably well-balanced life as it looks like to you. So I was like, oh, I could do this. I want to do this. And so I spent the better part of my high school and college career thinking about how I'm going to get into med school. And ultimately, that's the route that I went. And the way I discovered interventional radiology was just, I was like, I want this balance between operating on people and good clinical medicine that kind of covers everything from head to toe. And that's how I got into this. And really what I loved about it was watching someone go from sick on the table to better and seeing them leave the hospital in a couple of days. It was nothing like it.
You know, typically when we hear radiology, we kind of envision someone sitting in a dark room, looking at a computer screen or films, looking at images and just telling the referring doctors, here's what we see structurally. How did you kind of do that in most of your residency training and decide, you know what, I need more hands-on. I need to actually engage with the patient to pursue this fellowship. What was that kind of change for you?
I think the cool thing was when referring physicians would come down to you and review the imaging, and I'm the type of person, I hated being on the sidelines. That's one thing I just couldn't stand about being a diagnostic radiology resident was, a surgeon would come down, you review the imaging with them, and they decide what they're going to do based on that. And I was like, I want to do it. I want to be able to treat that. And I can actually use the imaging we're looking at right now. And all they're going to have is a little Band-Aid on their wrist or Band-Aid on their groin, and I'll take care of it. And that's what inspired me to go into interventional radiology.
Yeah, so tell us a little bit about that. What is interventional radiology? What are some of the conditions you treat? What are some of the problems that you see day to day in your practice?
Basically, to sum it up, we do minimally invasive image-guided procedures. And so that means that we can use a tiny puncture with a needle and put a catheter, which is basically a long tube, and track it all the way into the veins and arteries of the body and using x-rays and dye so we can see everything we're looking at without having to open up the patient. We treat vein disease. We treat arterial disease down in the legs. We treat kidney cancer, liver cancer. We treat something called pelvic congestion syndrome where women have chronic pelvic pain. We treat uterine fibroids. It's probably one of the most common things I treat. We treat enlarged prostate for benign prostate hyperplasia. We basically, inject particles into those organs to shrink them. And so there's a lot we can do. And basically at the end of the day, the patient goes home the same day with just a Band-Aid.
Would you say that of all the conditions you treat, you mentioned some of them previously, and it's going to be a tough question to answer, but try your best. How much of what you treat do you think could be treated or changed with lifestyle changes in your patients? When you see some of these conditions like arterial disease or vein issues, bleeding and trauma, stuff like that is different. When do you say to yourself, you know what, this could have been avoided had you just had a healthier lifestyle, didn't smoke as much, or ate better? Does that come up a lot, or is it separate?
When do I say that to myself? Every day, multiple times a day. Yeah, all the time. I don't even know where to begin with that, but basically, from an arterial disease standpoint, yeah, we see that all the time. Atherosclerotic disease, calcium developing in the arteries, that is a highly, highly preventable thing. And a lot of the precipitating factor is diabetes. So patients who have poor, not only blood sugar control, but the amount of fat they consume, all of those are inflammatory things that can actually produce calcium and atherosclerotic plaque in their blood vessels. And I do try to counsel my patients on it and say, listen, we're treating it now, we put in the stents, but you don't have to go through this again if we can change that. And there are a whole host of diseases that are preventable. We've looked at prostate cancer. There's a direct link of dairy consumption to prostate cancer. And so is it causative definitively? No, but there is a direct link. The more dairy you consume, the lower you can precipitate the enlargement of the prostate and prostate cancer. So those are preventable things. It comes up all the time.
Going back to chronic diseases, heart disease, diabetes, cancer, these are almost 2/3 of the U.S. healthcare spend. We spend $4 trillion on healthcare in the United States, 2/3 of which could be preventable by changing our lifestyle. And one of the changes in lifestyle is diet. So I want to kind of dive into diet, specifically your practice. And let's talk about nomenclature. So veganism versus plant-based. What's the right way? What do you identify with? How should we be kind of characterizing this practice of diet?
That is a great question. And a lot of people are confused with that right now, especially because it's being so highly marketed, right? A lot of people are calling things plant-based, or even products that you'll buy will say vegan on them or plant-based. And they're doing that just to get you to buy it, but really no one knows what exactly that means. So the way I kind of separate it is that plant-based means that it doesn't mean plant only, it means plant-based, plant predominant. And a lot of people, for them, are having things that are no meat, no dairy. You could kind of sum it up that way. And they're having basically vegetables, legumes, fruits, and trying to minimize their oil intake if they want to be really low-fat, whole food, plant-based. Veganism is even kind of encompasses plant-based, but it also kind of involves the ethics as well. So veganism, like someone like me, I'm not only plant-based, I'm actually vegan. Meaning I don't wear leather, I don't wear any animal products of any kind, because I've seen what the animal industry does and animal agriculture does to our environment, to the animals. So that's kind of how you separate them. I think a lot of people will say they're plant-based from a diet perspective, but they're not necessarily vegan. Vegans kind of encompass both.
So, you and I are both of Indian descent. Not only that, we're North Indian, we're Punjabi. And, Punjabi people are known to be big and burly and farmers, and we eat meat because that is masculine. And in our societies and culture, parties, communities, eating meat's part of it. Chicken tikka masala. I mean, that's one of the things that we eat. At what point did you make that transition from being a meat eater or eating meat to saying, you know what, I don't want to do this anymore? What was that trigger, and when did that happen for you?
Well, I actually first became vegetarian in my junior year in college, 2004. And I can tell you that my family, who's very Punjabi, was like, what are you doing? How can you not have butter chicken? How can you not have chicken tikka masala anymore? Because I used to enjoy that with all of them. They thought I was crazy. And so, yeah, 2004. And literally the way that happened, I was studying with my friends for a biochem exam the night before. We went to the hospital cafeteria at Emory, had chicken fingers and fries. I woke up the next day, opened up my refrigerator, and the desire for meat was gone. It was just like this, my brain switched. And so since 2004, overnight, not had a touch of meat. The dairy thing didn't come in until 2017. And I would say the most significant factor in that, my Masi, which is my mom's sister, she had become vegan a number of years before that. She was talking about it all the time, and she was like, listen, with the way that you are into meditation and you're into weightlifting and everything, and you're already vegetarian, let's talk about the vegan lifestyle. And she's talked about it. I thought it was crazy. Then a movie came out in 2017, What the Health? And that movie, once I saw the benefits of going plant-based, vegan, from the economic standpoint, from the animal standpoint, from environment, for my own health, it was just a no-brainer. And so that's what was the tipping point for me.
It's interesting. There's another documentary on Netflix called Game Changers, which kind of highlighted these very, very high-level athletes, bodybuilders, pro athletes, NFL players, all plant-based. Now, I don't know whether they're vegan or not, but they're plant-based, no dairy, no meat. And you can see how they transform their bodies. And it was interesting. They took blood samples from these individuals, and you could see fat on top of their blood in the people who ate meat, and very clear supernatant in those that did not. So when you went vegetarian back in 2004, was it because of health, or was it immediately because of compassion for animals and the carbon footprint of the environment that goes into raising and breeding animals? What was that change for you?
I would say it was more so compassion, because at that point I'd been doing meditation for a good 7 years or so. And so the deeper and deeper I got into it, I sort of was getting into this. I guess I was 19, 20 years old, and I'm already having these existential crises about life, unlike most people. And I was kind of thinking, like, who are we? What are we? We're kind of one with everything. Where do I end? Where does everyone begin? And sort of thinking systemically like that as a college kid, I was like, I don't think I can eat these animals anymore. And so that's where I think it was more of a compassion thing.
It's interesting. In high school, I became vegetarian. I was vegetarian for 4 years, from sophomore year of high school through freshman year of college. And part of mine was kind of the same thing. It was religious. My religion is Sikhism, and we believe that God resides in everything, in you and me and plants and animals. And you're right. When you kind of think about that, you're like, how could I be involved in taking someone's life? And I think there's such a disconnect with what we eat and how it gets to our plate, which is why most of us grow up eating chicken nuggets. We eat it and we like it. But then you have that realization that, how did this animal actually get onto my plate? And that's when you take a step back and say, hey, I don't want to do this anymore. So I did this for 4 years. What changed for me in college? To be honest, I don't know. I think it was, I missed the taste of meat, which is unfortunate because now there's so many substitutes, which probably isn't necessary.
Yeah.
So tell me about your diet. Like, what do you eat? What do you eat in a morning? What do you eat for lunch and dinner and snack and things like that? What is that like?
So every breakfast for me is always the same. But good thing there's variety. I use a company called Daily Harvest. And if anyone out there doesn't know them, definitely check it out. They're awesome. Basically what you do is you just get smoothies. And so they'll have a mix of, it might be kale and spinach and mango and another fruit and flax seeds, for example. And it all comes frozen. And I will order like 7 to 14 of them, so it covers you for a week or two. And I mix that with a plant-based protein, and I have that on my way to work. And then for lunch, I have always found something that I can always turn vegan. So where everyone might be served at the hospital cafeteria rice and meat, I'll just add rice and beans, like kidney beans, and with a bunch of vegetables on it. And I'll kind of spice it up like sriracha or something like that. I'll have the tofu bowl, which they also have at work, and veggie wraps. There's always some type of variety, and I never really go hungry at lunch. For dinner, I'd say it's usually Indian food. We're fortunate to have someone who helps out at home and makes a lot of really good Indian food. So I have varieties of that. I'll have rice, lentils, lots of vegetables. It's a whole array of basically whole food plant-based, and I try to keep on the oil side very low if possible.
When you made that addition from vegetarian to vegan and you stopped dairy in 2017, what was that reasoning like? What was that kind of transition or thought process? And also, what did you notice in your own body after you made that transition?
So the transition was really, was what the health. When I really learned about how much the meat and dairy industry have a hold over our decisions. For example, when I started seeing that the sheer amount of cheese that's ending up in everything that we eat, and this was back in the 90s, when they were stuffing cheese in the crust of pizza, it was because we had a surplus. We've been subsidizing the dairy industry for so long. And so they had an overproduction, so they're kind of getting us to eat it. Then when I learned about how casein, the milk protein, is actually an oncogene, meaning it can turn on cancer cells, and cheese is actually highly addictive. There's a component of the casein called casomorphine. It's actually addictive to your brain. This is why especially Indian people who are vegetarian love cheese. We're known for it because it's just like, listen, this is all we can eat. So when I saw that, and I was like, well, I don't want to have the certain cancers. I don't want to gain the weight from the saturated fat from the cheese. Meat I'd already let go at that point from a compassion standpoint. And I was like, all right, you know what? I've already given up everything else. I can go vegan. For me, then it started becoming a positive thing. It's not what am I giving up, it's what am I adding in. And when you kind of take that approach, it's easy to do. You lose the desire for something, so you're not even craving it anymore.
A lot of listeners out there thinking, I want to work out, I want to lose weight, and we promote this high protein diet for weight loss, less carbs. And I'm imagining, if you're a vegan or vegetarian and you're not eating meat, like how are you getting full? Are you filling up on carbs? And if so, is that promoting weight loss or is that deleterious to your health?
So from the protein standpoint, people a lot of times forget plants have protein. And you might have seen this in Game Changers. They've described this thing. What does an ox eat? What does an elephant eat? What does a rhinoceros eat? They all eat plants. And so when you're eating meat, you're just eating it in the processed form. So why not go to the source itself? 80% of our soy, of our corn, those two major plant-based resources, 80% of them in the world, goes to animal-based agriculture. 70 billion animals and 7 billion people. That's 10 times the amount. So when we talk about a hunger shortage or a nutrition shortage in the world, why not redirect all of those resources to people who actually need it rather than the animals, and then kill the animal in the process? So no, there's absolutely no shortage of protein in a plant-based diet. If you're trying to bodybuild, if you're trying to get bigger, yes, you're going to need more than the average person. But the average person can get more than enough protein on just a plant-based diet alone. And we're talking about plants like spinach, you're talking about soybeans, you're talking about tofu, which is another form of soy. You name it, I could just go on and on and on. There's no shortage of protein in our diet. And in fact, Americans get more than other countries.
You bring up soy a couple of times, and there's things and myths and misnomers that you read about phytoestrogens and estrogens in soy, especially in men, intaking too much tofu for a man or eating edamame is bad for you. Is this true? Is there any logic or science behind this, or just kind of myth that we read?
It's all myths, just like all this other stuff. There's something called estrogens, and then there's phytoestrogens. Phytoestrogens are the ones that come from plants. The estrogens are the ones that have come processed through the animal itself, whether it's meat or dairy. So a phytoestrogen, one of the really well-knowns is isoflavones, and those come in soy. So that's why everyone's making a big deal about, am I as a man, I'm trying to think of the politically correct way to say this, but am I going to grow, in my chest area? No, you won't, because these are phytoestrogens. These are not the other estrogens we're talking about. They don't respond to estrogen receptors on your breast or for women, their uterine tissue the same way. And so you can eat them in large quantities. And there's actually been studies to show that, for example, isoflavones are protective against breast cancer, not promoting it. That's where we have to really separate those things. And that's sort of good when you ask me about vegan versus plant-based. It's phytoestrogens versus estrogens. The nomenclature kind of gets confusing for people. So I say, eat the phytoestrogens away. Enjoy them fully.
What about eating for strong bones? Growing up, there were these commercials, milk, it does a body good, got milk ads. Now, these were tremendous ads that have still stuck with us for, 30, 40 years. And we tell our patients, you need strong bones, drink dairy, have a glass of milk or yogurt or things like that. What are some other strategies, maybe even better for you, to maintain healthy bones and prevent osteoporosis in a plant-based diet?
So again, all that goes back to marketing again. We subsidized the dairy industry. We had to find a way to sell everyone milk and have them consume milk. Milk is a source of calcium, but there are so many other sources of calcium out there. And some of those, so the green leafy vegetables have a lot of calcium. Spinach, kale, a lot of the legumes. So kidney beans, soybeans, no shortage of calcium in those. If you kind of just approach this is why we say whole food plant-based. If you want to just create a colorful palette, make your food colorful. Think about all the things that you eat: the fruit, eat the vegetables, avoid the meat and dairy, and eat lots of legumes. You will get more than enough calcium. There's nothing that science has said. There's marketing says it, but nothing that science says that you have to consume meat and dairy to have enough calcium.
I like what you're saying about veganism as a belief system. It's not just about getting healthy for yourself. It is about compassion for animals. It is about carbon footprint in the environment. So I think making that transition is not easy. I think it does take some personal insight. I'm hoping that through this discussion and future discussions that we can actually make a meaningful change in how much animal we are consuming as a society, because just like you mentioned, not only it's the benefit for Earth and the environment, it's also preventing chronic diseases like diabetes, heart disease, cancer. Are there things that you miss that from back in the day of either eating meat or either eating dairy and cheese that you're like, man, I really do miss the taste of that? What are some of those things?
Honestly, I can't say I miss it anymore. And it's been a long time since I ever missed any of that stuff. And it kind of goes back to understanding the principle of it. Once you understand the principle, once you know what you're putting in your body and its systemic effect on society, because you have to think globally, right? If COVID taught us anything, you can't just think personally, you have to think globally. Once I had that, my brain switched and the desire is not even there. I don't even think about going back. I don't even think I could ever taste meat or dairy again. But sure, were there things that were especially good? I mean, listen, we live in New York City. There's nothing like a cheese pizza. And I don't mean you have to go to a special place. As you know, you can just be walking on the street and that place looks good. Go grab a slice. It's incredible. Paneer. I used to love paneer. Who doesn't?
Who doesn't?
It's incredible food. But the desire is not really there.
You mentioned paneer. We order saag paneer, which is spinach and the cheese cubes coming from the Indian restaurant. And at the end of our dinner, usually all the spinach is left in the container and all the cheese is gone. So I can certainly sympathize with cheese. What about these imitation meats? Like Impossible Burger, Beyond Meats, where I feel like people want to feel like they're eating a burger or feel like they're eating a chicken nugget, even though it's made out of whatever, beets and stuff like that. What do you think about that?
I think they taste good. I think they've done a great job trying to replicate the way meat tastes, especially for a former meat eater or someone trying to make the transition. They do a great job, but they're processed just like anything else. So everything in moderation. I do not expect, as much as I would love it, I don't expect the entire world to go vegan. But if you want to dabble and it helps you enjoy something like Meatless Mondays and you really love meat though, go for the veggie burger, the Beyond Burger, the Impossible Burger. You might be surprised. I've had to call some restaurants who I picked up an Impossible Burger from, be like, "Are you sure this is not the beef burger? Because this really it's scarily accurate." But it's processed, and you really want to kind of limit yourself on how much you have of those.
When it comes to weight loss, which is, I think, something that comes up a lot in my clinic for sure, in pain management and spine care, certainly in what you do, I focus a lot on a low-carb diet, either the keto or the paleo or some version of that, because traditionally we think of carbs causing a rise in glucose, which is sugar, which is known to raise inflammation in the body, leading to chronic diseases, diabetes, heart disease, etc. Whereas the plant-based diet doesn't really comment on carbohydrates, correct? So how do you kind of make that reconciliation of, I'm trying to lose weight, I'm trying to bring down inflammation, but there's no real cap or guidance on carbohydrate intake?
So if I had to sum up the whole weight loss thing, I think the best thing I could say is it doesn't matter what you eat. You have to burn more calories than you can consume. You could eat Cheerios as long as you burn more than the Cheerios you consume. I literally mean breakfast, lunch, and dinner. It doesn't really matter. Are you going to be healthy? No. So I am not going to go out there and say that the vegan diet or the whole food plant-based diet is the only way to lose weight. However, that said, in February 2021, the Journal of the American College of Nutrition came out with a study that was doing a head-to-head of the whole food plant-based diet versus the Mediterranean diet. And the Mediterranean diet is the one that's touted for the people who still like to have meat and dairy as like the way to lose weight and still kind of enjoy what you like. So this study was really profound because what it showed, and they actually did a crossover where 16 weeks of consuming each diet and then had a 4-week gap on that, so where you kind of ate like you normally ate before, and then they switched diets 16 weeks. And what they showed is that the whole food plant-based diet, they had significantly greater reductions in weight, cholesterol, glucose insulin sensitivity. The only thing that the Mediterranean diet had a more significant change in was reduction in 9 points in systolic blood pressure compared to the whole food plant-based diet. In all categories other than systolic blood pressure, the whole food plant-based diet outcompeted the Mediterranean diet. There was no restriction in calories in either one of them. There was no restriction in carbohydrates. So it really goes to show, where is all this coming from? Well, a lot of it is the inflammatory markers. A lot of it is saturated fat. You're not getting all that saturated fat in dairy. So this study was really profound in our literature to show what the whole food plant-based diet can do. This is even without calorie restriction. So no, you don't really have to limit your carbohydrate intake. You can consume them, but you just have to watch for it just like anything else.
And one of the other things that we don't talk a lot about is insulin-like growth factor, and that comes from animal protein. And despite how much carbs or even saturated, polyunsaturated fats you eat, animal protein causing a rise in insulin-like growth factor certainly leads to inflammation, which we know from that study. The challenge with studies is many of them, even head-to-head, compare it to SAD, the standard American diet, which if you actually look at the standard American diet, it's desserts, cookies, pizza. So any diet compared to that looks good, whether it's whole food plant-based or Mediterranean or whatever. But the study that you cited from the American Journal of Clinical Nutrition, it's head-to-head with Mediterranean diet, which always kind of wins the U.S. News and World Report best diet of that year. But the metrics and the findings that you mentioned are valid. So there's some evidence. There's some real evidence on diets and impact on healthcare problems, such as chronic disease. I want to turn to one more element of lifestyle medicine, certainly something that you're very, very passionate about, and that's mindfulness and meditation. You know, you spent a lot of time doing research at the Emory University Mind-Body program. Emory, as we know, is in Atlanta, Georgia. So tell us, how did you get involved with meditation? How is this impacting your life, and how do you kind of practice it on a day-to-day basis?
So the way I got involved with it, actually, going back to some of the existential crises I had, they actually started earlier than that. I was a little kid, actually, driving around with my mom to the various engagements we would have on Saturdays and things. So I grew up in a Hindu and Sikh background. So I would be going, on one day I'd be going to the Hindu temple, on another day I'd be going to Gurdwara, which is the Sikh temple. And when I would go there, what I was missing was something that was turning me inward. I said there's these external perceptions of whatever's happening, but they're talking about God, they're talking about going deep within, they're talking about compassion and all of us being one. But I was like, how do I experience that viscerally? And I used to ask my mom those questions. I'm literally like 8, 10 years old, and we're in the car driving around in Atlanta. And ultimately, when I was in high school, we discovered a book called Autobiography of a Yogi. And that's by Paramahansa Yogananda. And that book changed my life. It was the first real account of what the yogic lifestyle is like. And he came from India to the US to teach people a type of meditation called Kriya Yoga. And that's where my life changed, where I started learning that I could go deeper within. So even if I was at the Hindu temple or the Sikh temple, or actually it didn't matter where I was whatever I saw, that was the focal point, but then I could turn that within and gain deeper respect for whatever they were trying to say. And then it became a daily practice in my life. Morning and night, there was no way I was going to skip that. Did not matter what I did. You don't forget to eat. You don't forget to shower. Don't forget to meditate. That's how important it has become in my life. And I have noticed so many substantial changes in my life with with regard to how I approach patients, with my wife, with my son, with my family, you name it. Everything I do is kind of dictated by my meditation lifestyle.
So how do you do that without divulging too much of your personal practice? How do you actually perform your meditation practice in the morning and in the evening?
So in the morning, it's very, very brief because I've got a 1-year-old. So when I wake up, it's time to go to work, hang out with him, and get to work. But sometimes it's going to be as short as even 1 or 2 minutes. But those 1 or 2 minutes where you stop everything, you're not thinking about your family, your friends, your work, social media, nothing. You are literally just totally engaged in what you're doing. And that means just simply watching your breath for a couple of moments. It just transforms you. And then in the evening, it's just a longer version of that with some, being consciously aware of the energy as it goes up your spine. That's the concept of Kriya Yoga, basically. And that's what I do for about 30 to 45 minutes in the evening.
Now, at Emory, they had a very interesting program, the Emory Tibet program. And under the leadership of the Dalai Lama, you actually conducted research and studied meditation and the impact on stress, and not only stress, on immunity and your ability to fight infections. Tell me a little bit about that research. What did you find, and what were some of those results? Yeah,
this study came out in 2009, where I was working with this group, and it was in the Journal of Psychoneuroendocrinology. And basically what we were looking at was the effect of compassion meditation on stress and immunity. And so what we did was something called the Trier Social Stress Test by a doctor named Dr. Trier in Germany. And basically the idea was to take healthy volunteers and give them a stressor. And by giving them a stressor, to see how do they respond to those particular moments throughout the day. And we were measuring cortisol levels. We were measuring IL-6 levels. IL-6 is interleukin-6, and it's actually a very trending inflammatory marker right now, but in the past year, because we were measuring that in COVID patients. And what we looked at was 6 weeks of compassion meditation versus 6 weeks of a healthy control group. And what we saw is there was no significant difference in inflammatory or stress markers between the two groups, but within the meditation group, those who meditated for longer periods of time had significant reductions in interleukin-6 and cortisol levels. And there was a thing they filled out. Basically, it was looking at their stress levels. and it was a subjective level. And all of those were substantial reductions the longer they meditated. So what it was showing us basically is that when you're exposed to these stressors, your levels of stress, your hits to immunity were substantially lower the longer you meditated.
So there is some type of dose relationship between meditation, mindfulness, going inward, and its effect on biomarkers in the body, such as cortisol and IL-6.
Yep.
So, technology comes into these pure spaces like meditation, like mindfulness, and they want to impart their effect. So all these apps come out like Calm and Headspace to try to make people detach from technology. What do you think about these apps? Have you used them? What have you found their benefit to be?
I think they're great because they are popularizing something that I think we all need. So I don't care how you get there as long as you get there. And if it's going to make a regular practice for you and it's sustainable, then go for it. Yeah, you're going to be on the app and you might get distracted by a phone call at the same time. The good thing is that a lot of these work with airplane mode, so you can fully engage yourself in it. And now Headspace came out with a whole Netflix series, 2 of them. And so I do feel that if it allows you to create a regular practice, then go for it. My ultimate hope, though, is that you don't need the app, that you've created a self-sustaining practice that you can do on your own, even better with some other people who are into it, and you create a really nice vibe together. But I think there's a huge market share that those 2 companies you mentioned, Headspace and Calm, have. And if it's popularizing it and making it popular for people, go for it. It's a great way to start and even continue.
What I'd love to see is the outcomes from people downloading and using these apps. Does that lead to less chronic disease in the United States, less diabetes, less heart disease? I mean, that's going to be a very tough thing to track. But with changing your lifestyle through diet, like we talked about, with some stress and anxiety management, sleep patterns, a lot of things that affect our day-to-day lives, I'm hoping to see that lead to less chronic disease and less expenditure of our healthcare dollars on things that are prevented or modifiable. What do you say to our listeners who are maybe on the fence of changing their diet? Maybe they are compassionate. They just don't know how to make that transition. What are some strategies on going from I wouldn't say animal predominant, but animal diet to more of a whole food, plant-based diet?
When you look at the vegan community and all of the influencers out there and the well-known physicians and everyone in the vegan space, you've got a whole range of people. And the most extreme ones who scare people away from doing it, it kind of comes with judgment, right? So people kind of judge people for not making that transition once you know, how could you not do that? My whole thing is that veganism is on the premise of kindness. So be kind to yourself. If you can't be kind to yourself, how can you be kind to anyone else? So start slow. You don't have to do it overnight. Learn the information. Listen to some of my advice. Follow some of the people out there who can help you with the transition. Sometimes there's really well-known dietitians out there who can help you make that transition. But be kind to yourself. Start slow. Maybe Meatless Monday, and that's a really good way to do it from the meat standpoint. Just start making those transitions. Think of it as whole food, plant-based. How can I eat the way people always did that's less processed? If I can start adding that in a couple of times a week to even a couple of times a day, you don't have to do it overnight, you're going to start seeing changes and you're going to say, wow, I feel really good. Maybe I want to change this. And then who knows, you may become 100% or you may be kind of cruising at about an 80%. That's all good. But just make the change because it's possible.
I think what you're saying is very true, of not going 0 to 60 and kind of leaning into this idea of compassion. Charles Darwin, father of evolution, he's got this quote. He says, "There's no fundamental difference between man and animals in their ability to feel pleasure and pain, happiness and misery." I mean, this is hundreds of years ago with that school of thought. And I want to go back to one other thing you said about the subsidies. I went to Sweet Green the other day to have a salad, which was a Cobb salad, veggie. I didn't get feta cheese. You'd be very proud of me. I mean, this salad was $16. Whereas you go to like some of these fast food places and you can get a burger for $1 or $2. I think a lot has to change. And that's the problem with the science of nutrition, that it's so heavy politicized, just like kind of religion is, where it's really tough to get real hardcore data other than the study that you mentioned about comparing diets and how does that lead to better healthcare outcomes. What else for our listeners? What else can we share with them that will lead to a better lifestyle? Things that you and I treat are largely modifiable. Some of the things that you treat with the bleeding and things like that aren't necessarily, but I think we can really make a change in preventable health and treat illness with modifying our life. Closing thoughts for our listeners, Dr. Bahl.
I think educate yourself. The more you know, the more empowered you are. And there's a lot of misinformation out there, as we've known the past couple of years, where the powers that be, they kind of profit from confusion. So don't blame yourself. Never, ever blame yourself. Again, I always go back to kindness. Be kind to yourself as you figure this process out. Know that you actually have the power to change, and it's okay if it's not done overnight. Use the resources you have, educate yourself, and I think once you start doing that, you will feel so much better. And you can read all the papers, you can hear everyone else's experiences, but there's no substitute for your own experience. Once you feel it for yourself, start telling everyone else in a non-judgmental way, but they're going to start loving you for it, and they're going to feel great themselves.
Words to live by. I certainly appreciate that. Ultimately, veganism is an incredibly powerful way not to only make kinder choices for your health, but also kinder choices for the animals and the planet. So thank you, Dr. Bahl, for sharing your expertise. And one thing I didn't mention, we go back to power, we put weightlifting and bodybuilding. This is a podcast, so you guys can't see what I'm seeing. Dr. Bahl is jacked and cut, 6-pack, 8-pack. And he doesn't eat meat or dairy. So please take that to heart when you're thinking about making that transition and transforming your body. So thank you all out there to the listeners to tuning in to The Backstory on a discussion on lifestyle medicine. And remember, when it comes to your health, when it comes to your body, we've got your back. Thank you, Dr. Bahl.
Thank you.
Thanks for listening to The Backstory. Please subscribe, rate the podcast, and review The Backstory on Apple Podcast, Spotify, and Google Play Music. And feel free to share this podcast on social media or even your own website or blog. This podcast is for general information purposes only. It does not constitute the practice of medicine, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information is at the user's own risk. The content of this podcast is not intended to be a substitute for medical advice. To learn more about Dr. Singh and his clinical research, please follow him on social media. You can also sign up for his newsletter by going to www.rickysinghmd.com. That's RICKYSINGHMD.com.